My name's Janet Keyworth. I'm one of the clinical nurse specialists working in dermatology department at Rotherham General Hospital. Acne is quite a common condition that affects mainly teenagers. Having said that, we see people in the 40s and 50s that have got acne, but it does predominantly start in your teenage years. And it usually starts when your hormones kick in, and there's hormone substances called androgens that stimulate your hair follicles to produce more sebum, more oil. When your pores get blocked up, then you tend to get these red spots, and you also get blackheads. And quite a number of people get blackheads, and they quite often don't realise that that is part of the acne because the grease is getting blocked in your pores. And it usually affects your face, chest or back. Some people just have one, some people have all three areas affected, and these are areas that produce more sebum. There's lots of myths surrounding acne, and people often associate it with, people not washing properly. That's why they get these spots, because they're dirty. It's nothing to do with that at all, although we do encourage acne patients to wash more often because they're producing too much grease, then the skin does get oily, so they would need to wash more often, but it's not a cause through being dirty. First thing to do is to buy over-the-counter products. There's lots of facial washes that you can buy, and they are quite helpful, and that would be the first thing. If the acne is severe that the facial washes aren't sufficient, then you should really go and see your GP and be prescribed something. First treatment that your GP would prescribe would be a cream, and that might be a cream that contains an antibiotic that you can use every day. And for some people that sort of gets on top of their acne. If the acne if it's not convenient to be putting creams on, if it's on your chest and back as well as your face, then the cream's not working, then your GP should really start you on an antibiotic tablet. And the thing is, when you take antibiotic tablets for acne, you need to be on them at least 2 to 3 months before you can see a result. After 6 months treatment, then for a lot of people they're clear for the rest of their lives. Some people unfortunately still struggle, maybe not to the severity as when they first came, but they still struggle to some extent.
For more information, visit www.nhs.uk.